Good evening. I would like to first introduce myself. My name is Dr. Lee Ching Lee. I'm a dietitian by training and also a senior lecturer with the IMU University. And today here with me is Professor Dr. Winnie Chi. Hi, Prof. Winnie.
Hi,
Yeah,
Jingli.
who's Pro Vice Chancellor Academic at IMU and also a registered dietitian. I think we are both registered dietitians. We're going to talk a little bit about that later on. But welcome to our first live talk 2025. And today we are going to tap into Prof. Winnie's perspective as to what dietetics means for her, so that when you listen to her story, you can then find out whether dietetics is right for you, because there might be some of you who are thinking of whether you want to be dietitians in the future. So is this a suitable profession or not? Right? We hope to help you answer your question. So before I begin interviewing Prof. Winnie, let me just bring you through some housekeeping rules. So you will find that we have actually muted your microphones, and this is so that everyone can have a good listen in. So if you're curious, you have comments or you have questions, what you can do is type your questions on the Q&A panel. So there will be a button that allows you to ask your questions. Put your questions into that box, right? And throughout the interview, I'll be keeping my eye open for your questions, and we will address your questions in a timely manner as soon as we can. And a final reminder, this live webinar will be also recorded. Okay, I'll stop sharing and now ask Prof. Winnie my first question. Maybe to get the ball rolling, Prof. Winnie, maybe would you like to tell our audience a little bit about yourself? Introduce yourself.
Right. Thank you, Jingli. So, Jingli is my colleague, and we both work together in the Nutrition and Dietetics department here in IMU. Well, I'm in my late 50s already, so you can see that my career has spanned quite a long while. So I've worked in the field of nutrition and dietetics particularly, for the past 30 over years already. So when I first started, in those days after STPM, you will apply to do some courses in public universities. So way back in 1987, that time when I first joined university, there were very few private universities, not like now, where everyone has such a choice, right? Because they have so many universities they can choose from. So at that time was mainly only the public university. So I was offered a degree in dietetics. So I joined University Kebangsaan Malaysia, or UKM, and they were the only university that actually offers the dietetics degree. So they were the first in this country to offer a dietetics degree. And when I joined UKM, I was the fourth batch. So the fourth graduates that when we produce local dietitians, that means dietitians who are locally trained. Before that, dietitians were mostly trained from overseas, especially from the UK. So after I finished my degree, I then worked for a little while as a dietitian. I was working in a weight management center. But after that, I got interested to pursue my postgraduate, because it's always been in me that I wanted to teach. I want to be in academia. I want to teach. So that's why I did my master's. And in my master's degree, I ventured into nutrition science using my dietetics background. So we were looking at energy requirement for Malaysians. So today, when you calculate how much energy do Malaysians need to eat to survive, and what's the basal metabolic rate, that was actually my master's degree. So after that, I joined UKM as a junior lecturer, and a few years down the road, I pursued my PhD. So my PhD was looking at dietary intervention for bone health, to look at older adults and see whether adequate calcium intake was important for bone health. Since then, I've not left UKM, so I served as a lecturer in UKM until 2008, and then after that, I joined IMU. So now I'm already about 16 years in IMU. Now, why I joined IMU was because at that time, IMU was starting a new degree, and that degree was Nutrition and Dietetics. I think both, Chinli, you and I are the pioneers who joined IMU to shape the program of Nutrition and Dietetics in IMU. And since then, I've not looked back, because we wanted to produce different quality of graduates. Having been in the profession for a long time, and in fact, throughout my profession, even though I'm a lecturer, I still kept up my dietetics practice. So I was practicing even when I was in UKM, and now today, even in IMU, I'm still practicing as a dietitian. So are you. So we both serve the IMU Healthcare Clinic. But coming back to my point that I could see when we first started, the profession was actually not very well recognized, I must say. Nobody knows who's a dietitian. They know nutritionists, or, you talk about healthy eating, you advise people how to eat well, but not dietetics. What is this dietetics, Even when I joined very first time in this degree, I wasn't clear also what is dietetics, but now I really love it, right? And because of the fact that nutrition and the application of nutrition in disease, dietetics or medical nutrition therapy actually has become very, very important. Because also you look at the landscape of our population right now, more and more obesity, diabetes, chronic kidney disease, is coming up. And then all the hospitals start to realize that you really need dietitians because, even patients in ICU need dietitians, everyone, to make sure that the recovery process is there through nutrition. So when I saw that gap, I decided that, way back in UKM, we founded the Malaysian Dietitians Association. So I was one of the pioneer council member that in the pioneer group that founded the Malaysian Dietitians Association. And it was actually, after that, I took over after a couple of years. I was president of MDA from 2014 to 2023. So that's about, I think, 3 terms, about 6 years. And I wanted to lead the profession because I want to raise the visibility and the importance of the profession in the eyes of the public, as well as our stakeholders, okay? Especially the doctors, the nurses, the healthcare professionals that we work with, and the public to know who are dietitians. And I have not looked back since, so we have actually worked very hard to increase the visibility of dietitians. That's why I'm very happy to see that today we have this webinar, and already people have signed up to want to know more about the profession. But if you look back about 30 years ago, probably nobody will be interested to know who are dietitians. Since then, I've also happy to tell you that we worked hard to look at registration of dietitian as a professional registered with the Ministry of Health. So I'm currently also serving my 2nd term as a council member of the Malaysian Allied Health Professions Council. So maybe we can talk more about what is the importance of this as we go along. So in a nutshell, very hard to talk about 30 over years of career in 2 minutes, but I did so basically, so it's a very long career, and I'm very happy to be in this profession and very happy to contribute further to ensure that the profession continues to grow.
Yeah. I mean, you've done a lot. You've done a lot for dietetics too. I think the thing that you mentioned is you work very hard to increase the visibility of dietitians and even towards promoting the need. And now we have that registered dietitians. Maybe just as an introduction to our audiences, who are dietitians actually? What do they do? And is there really need for dietitians, right? And then maybe, what is this registered dietitian business all about?
Okay, so that's a great question, Chili. Maybe some of our audience are logging in to know more about the profession. And of course, all this work is not done by me alone. It's actually the hard work of a group of individuals and also the Malaysian Dietitians Association, whose work is to champion for the profession. So who are dietitians? Dietitians are actually a profession. Now we're a registered profession, and we look at the impact of food as medicine. We call that medical nutrition therapy. Okay? So now we know that there's overwhelming evidence that medical nutrition therapy can transform lives, help individuals to prevent disease, manage their disease, as well as recover from illness, and prevent other complications that happens, in the disease course. So dietitian is the qualified expert that provides this medical nutrition. So when you say dietitians, we don't mean that, you just tell us what to eat, what not to eat lah. That's it, right? What's the big deal, right? What's so great about this profession? But actually we are, I would like to call ourselves, in a nutshell, it's like a doctor who treats you using medication. So I am actually, dietitians are actually treating diseases using food, right? But evidence-based, meaning we follow the allopathic evidence-based medicine way. And what we do is we will assess, we diagnose, and then we look at dietary problems using food, right? Or we call medical nutrition therapy. The other thing that dietitians do is we translate scientific information about nutrition, about health, and about disease into practical guidance. So we teach our patients how to get the nutrients that they needed, right? In the manner, to suit their appropriate lifestyle and their dietary pattern, your food choices.
Yeah.
So we're very good, whether you're Malay or Chinese or Indian or other races, right? The dietitian is very familiar with your lifestyle, your dietary pattern, and then we are able to personalize the medical nutrition therapy for you. The other thing that dietitians do is we are also experts in provision of food. So many of us also work in food service. So if you look at all the, especially clinical settings like hospitals, the head of the department that actually supplies food to the patient is the dietitian. Okay, so we work very closely with the chefs and also the other professionals involved in preparing food because we are also expert in providing safe and nutritious foods lah. We can also provide food in schools, in rehabilitation centers. So some schools, private schools may have services of a dietitian. Even nursing homes will have dietitian. And also, of course, very specific clinical areas will have dietitian. So that's why these are what dietitians do. So it's beyond just giving dietary advice and telling people what to eat, what not to eat. We are actually healthcare professionals, allied health professionals that use food as medical nutrition treatment.
Yeah, so it's more than just eat more fruits and vegetables and drink
Yes,
water,
definitely.
right?
Yes,
It's
definitely.
specific interventions, to help people back to their health goals, very specific
Yes.
health goals,
Yeah,
and also
that's right.
menu planning, in the food service sector. Earlier in this session, you mentioned a little bit about how it was a milestone for Malaysian dietitians to finally be registered.
Yeah.
What is this registration? Is it the same as, like doctors are also registered, nurses
Yes, it is the
registered?
same.
So
Yes,
what
so
is this? Yeah.
doctors, so medical doctors we know are registered, and also dental, of course, then nursing, then pharmacies, and now dietitians, and we all are under the group called allied health profession. Okay, so this actually again took many, many years, almost 30 years. When I was a student, already we were talking that we need to regulate the profession. Why? Because we deal with human lives, right? So we deal with human lives and we're also in the clinical space. So therefore, it needs to be regulated to ensure the best quality of care is given to Malaysian public. So this whole registration is actually meant to protect the safety of the public for healthcare professionals because we take care of them, right? So in many countries around the world, dietitians, not necessarily all countries have registered dietitian. So Malaysia is very fortunate, thanks to all our gurus who has worked hard to fight for the profession and lobby the government to say that allied health should be registered. So if you want to, so now the act is out. I mean, the act has been out since 2016, and we're already starting to register dietitians and also other allied health professions in the country. It's a huge milestone for allied health professionals. It means that if you need to consult somebody on medical nutrition therapy, make sure that you see a registered dietitian. So similarly, any company, any hospital, any healthcare facilities that want to give medical nutrition therapy services must hire a registered dietitian. So that is what it means. And the other advantage is that we must also renew our practicing license, right? So in order to renew, we must update ourselves, right? So this will ensure the quality and the standards of care that will protect the safety of the Malaysian public, right? So that in a nutshell is why registration is so important and why we are so proud that we are a registered professional as well.
Yeah. Okay, so for the viewers that have just joined us, just a short recap. With me is Professor Dr. Winnie Chee, a very recognized dietitian in Malaysia, and we're both actually teaching faculty as well at IMU University. So Prof. Winnie was just sharing her, just a snippet about her career, what she's done in dietetics. And then we talked a little bit about what dietitians are, and then we talked about being a registered dietitian. So if you have questions, do remember to put them in the question and answer session. So all this registration, the talk about registration and how dietitians play an important role. What's the career growth like? Do we really need dietitians?
Yes,
Yeah.
yeah, that's a great question, because if you're going to join a profession, make sure that it's
Yeah.
needed, right? And there must
Yeah.
be career growth.
Yeah.
Otherwise, there's no future, and it's
Yeah.
very,
That's
very,
right.
very important that you grow in your profession. So let's first take a look at what is the country's need for a dietitian. I think this is key. If the country don't need you, then why are you studying the course, right? Why are we producing more and more dietitians for the country? So to be very honest, it's definitely not met. We don't have enough dietitians. You can see that the rise in especially non-communicable diseases, obesity, diabetes, high blood pressure, high cholesterol is very high in the country, more and more. Obesity is now where 50% of our population is overweight or obese already. So that's very alarming. So nutrition and diet play such an important role. How many dietitians do we have in the country? We have started the registration. In the government sector, we've got 500 over dietitians, but majority of the dietitians is actually serving in the private sector, right? So we think that we've already registered 1,000 over dietitians, probably about 2,000 plus. 2,000, let's say 3,000 dietitians for a population of 35 million now, really not enough, right? So by ratio, right, we are like 1.2 dietitians for every 100,000 population.
That's
So
not
no,
enough.
cannot. Definitely not enough.
Not enough.
And the projection is that by 2027, at least in government, they need to hire up to at least another additional 850 dietitians to serve the government sector, So definitely if we combine private and public, it's about 3 dietitians per 100,000 population. And if you look at countries like Japan, Australia, US, Korea, 15 to 20 dietitians per 100,000 population. So we are single digit, whereas in a lot of these countries, they're double digit, So for sure, there's growth. There's definitely need, and there's a lot of growth in terms of the need for dietitians in the country.
So growth in what areas? A lot of people think that perhaps when you think dietetics, right, then you think clinical. So
Yeah.
the growth there can I
Hospitals
just
only.
so are dietitians only limited to the
Yeah, I
hospital?
know.
Or just now
We
you
get
said
a
something
lot
about
of
food
questions.
service. Where can dietitians work in? Yeah.
That's a great question. Actually, a lot of parents, right, as you know, always say, a dietitian in hospital, how many you need,
Yeah.
right? But actually, hospitals are growing a lot. If you look at all the private
Yeah.
hospitals, right, they are actually opening branches everywhere in the
That's
country.
right.
And in MDA, almost, I would say, every week, there's always one vacancy now, So the key thing is that it's compulsory. I mean, it's by law, you must have dietitians.
Yes.
And
Yes.
in hospital, actually, they go by the number of beds they have. The bigger the hospital, the more dietitians, for example, okay, or dietitians that work with obesity, diabetes, like you and me. They need dietitians in kidney, working with kidney patients, ICU, and so on. So I think the growth within the hospital group itself is a lot. But beyond hospital, because I know sometimes young people, they don't work in a hospital, right? Hospital is hard work lah, basically.
Yes.
What about if I'm outside? What about the health and wellness, lifestyle, digital health space? I'm happy to tell you that now more dietitians are actually working in that space, because you can see the ratio of dietitians in private sector is more than in government at the moment. So where do they work? Retail pharmacies now hire a lot of dietitians, right? You see the large retail pharmacy group, you know why? They are primary care, okay? And they realize that when public walk in and say, I've got diabetes, I'm looking at my high blood pressure medicine, they know that holistic care, it cannot be just about taking your medicine. It's also about lifestyle changes. It's also about getting a chance to actually teach you about medical nutrition therapy. So therefore, now we see quite a lot of our dietitians is hired in retail pharmacies, and their career growth is not bad, because once they enter, if they perform well, they can actually become unit heads and all that as well, just like in the hospital. Some dietitians work in the digital health space, so that one is very flexible, because you can work anywhere,
Yes.
and they actually provide services across countries even. Okay, so it's quite exciting now what they're doing there. There are dietitians who social media content developers, especially the current generation. So I think that's great, because we need qualified people to be content developer. you know, you want to be an influencer, you better be qualified in it lah,
Yes.
rather than
Yes.
you're just, you know, promoting all sorts of food and all that when you don't really know whether is it safe or not for the public to consume. So we do, it'll be nice to see more dietitians qualified who can become social media influencers, but promoting evidence-based medical nutrition therapy. So we start to see that. Another big area that's coming up is entrepreneurs. Right? So a lot of dietitians are now entrepreneurs. They set up their own private practices. They also tie in with health food provision, and they also set up wellness cafes, home dietetic services, you know. So it's very exciting to see this new area of dietetics that our graduates are going into. Yes, in the olden days, in my time, hospital, that's about it, right? Government or private, that's it, you know. But now, as long as people want to eat, people want to eat about healthy food, learn more about health, they'll hire a dietitian. Even confinement centers now hire dietitian.
Yes.
Yeah.
Yes.
So it's very exciting how the landscape has changed for this profession.
Yeah. I think we have one alumni. I mean, now when you mentioned confinement center, who was a dietitian for hospital, then she became a dietitian for confinement center, and now is a dietitian and a lactation expert. So she
Wow.
specializes in that, you know.
Yeah. So you can actually expand and move into areas of specialization, which
Yes.
is the next milestone after registration.
I'm excited to see that because I remember when I start off, it's mainly just general
General
dietetics,
dietetics.
right? But I can
Right.
see now,
Yeah.
yeah, the specialty growing, you know, we can specialize in
Yeah.
areas we want to.
Yeah, so if I can talk a little bit about the sort of course, this specialty at the moment or expert practice is not yet regulated lah, but it's coming because it's
Yes.
already part of the act. But I see dietitians whose focuses on renal, pediatrics, right? Bariatric surgery as well. So there are bariatric surgery centers that hire dietitians specific for that. Gastroenterology, maternal child health. And of course, like you and I, we work in the space of diabetes, obesity, cardiovascular disease. Now, don't forget, it's not just within the dietetics area. You can do your MBA, right? Because a lot of dietitians actually move up in their career to become, because we don't know the skill that we have. We're good in communication. We're good in systematic thinking because you have to assess, you have to, you know, discover what is the problem, then you must find the solution. So that kind of thinking is very good for leadership. We have dietitians who have become CFOs, right? General managers, because they started off as dietetics, but they apply and transfer that skill to move up further in their career. So I think the sky is the limit, frankly. Because of the skill set that dietitians have, they're able to make difficult things simple. Right? Difficult concepts can be told very simple. So that is a very fantastic skill, and they're great communicators. To be a dietitian, you got to have great communication, right? Because we deliver our message and through talking, through actually motivating people to change behavior. So all this skill set is very good beyond just the dietetics field. So if you have this strong skill set, actually, you start off as a dietitian, but you may end up a CEO.
Very true. So we've spoken or we've discussed in length already about who dietitians are, what they do, the need for them, and you know how a dietitian is very versatile. But some of the things that you say can be quite scary. You know, for example, wow, we can be a CEO. We need to be people person. So maybe the introvert gets a bit frightened, or somebody who's not so analytical go like, hey, but I don't have those skills, right? And as an educator, those skills actually, right, can be learned, right?
Yes,
Yes.
absolutely.
So, and if it doesn't come naturally, it can be learned. Can you tell us a little bit more about how the IMU curriculum was designed? Because you said you came in, you started, you're a pioneer, I was there. I remember you told me that you joined IMU. It's the first private university. So it's kind of scary, you know, you go from a government to a private university. So I asked you, why did you do that? And you say, no, I want to design a curriculum that makes a difference. Right. You want to tell me more about that? Yeah.
Okay. Yeah, sure. So I think training of dietitians have come a very long way, Jingli. I mean, I was the fourth batch in UKM. I think after that came you, right? So
No, I think mine is
majority, bit later lah, yeah.
much
You're much
later.
younger, okay. So the key thing here is that we were the pioneers in UKM. That's true. So many of us were trained in UKM. Then after that, other public universities came up, and now private IMU also has a few other private institutions also now offer our dietetics program. So it shows that the development and the need for the profession, which is good. But why IMU? Because first of all, we have a great background in in medicine. Okay, and dietetics and medicine is very closely linked, right? So having those experts in medicine also, and the pedagogy of being a medical school actually helps us to develop a great dietetics program because the grounding and the foundation is strong. Okay, so we learn a lot from our medical colleagues, how they design the curriculum, and we design it for IMU. Okay, and what we were targeting when we design for IMU is that it has to be very hands-on learning. From day one itself, even at semester one, we already brought in the real world into the classroom. Remember, our students, even today, they have to write articles, they have to go out and interview people, look at what people are eating, and we constantly get our students to be well aware, because if you're going to influence behavior change, right, and you're going to talk about healthier approach towards food, your own basic skill got to be good. All right, so we put in a lot of practical aspects into our curriculum. And by year 3, they are in authentic learning environments already, isn't it? They are out there already, not just always in the classroom. Okay. And then the other thing is the interprofessional learning. So our final year students, right, they will learn side by side with the medical doctors, side by side medical students, and also with the nursing students and other healthcare professionals, even Chinese medicine students, okay, to see how dietetics actually is so interlinked and how it's being applied. So I think that is another strength, and a whole year in clinical placement. So the curriculum is actually very well designed. And when our students go out and graduate, they are able to hit the ground running.
Yeah.
Okay, so no more hand holding, because they are very independent in the final year. They have to see cases on their own. Of course, they are guided by clinical instructors and all that. And you talked about introverts, isn't it?
Yes.
Actually, in our curriculum, and you know that, we get you talking from day one itself, right? So you learn how to present in class already. Actually, you got no choice. And you'll find that we give you a lot of feedback, good feedback, right? To be able to be very confident. So by the time they reach semester 8, they're all very confident already. And that's one of the feedback that we get from employers. I'm a student, they demonstrate confidence, right? And they are very evidence-based, because we teach them that whatever we do must be based on science, So I think those are some of the good qualities that why we make a difference when it comes to IMU graduates in dietetics.
Okay, we have 2 questions in the chat box.
Okay.
So maybe we'll address your questions as they come, so that you don't have to keep thinking about the questions. Then we'll come back to the curriculum. But the questions actually are in relation as well. There's one that really true. So how you talk about differentiating a dietitian or highlighting the dietitian. How are dietitians very different from nutritionists?
Okay, so actually, this is a very common question. People get confused between dietitians and nutritionists, right? Actually, we are like conjoined twins. We are actually from the same group. Nutrition science forms the basis for dietetics. So in the very beginning of the curriculum, you find that whatever you need to learn nutrition first. Then you apply those principles of nutrition for the purpose of disease management, and that would be the dietetics part of it. So in fact, in IMU now, with our new approach, right, we have synchronized the curriculum to be, if you can't make up your mind, I want to be nutritionist or I want to be dietitian, okay? How do I decide? Now with the new curriculum, we actually study the same curriculum for the first 3 semesters. So then from there, after you get to know both dietetics as well as nutrition, you can decide whether which one you prefer, okay? So if you think I'm more inclined towards clinical, I like more clinical, then go for dietetics. If you prefer to go more public health, more community health, more about prevention, then working with policies, working with industry, then perhaps you should choose nutrition, okay? So the second question was about the duration, right? I saw.
We
3
saw
and 4
like
years.
how long is this degree?
So actually, in most public universities, both degrees are 4 years. But in private universities, we are able to concise the curriculum without losing the essence or losing the content and all that and the competency. Our nutrition degrees are 3 years and the dietetics is 4 years because the final year you have to be top up on your clinical aspects. The food service, the clinical, the medical nutrition therapy will require an additional year of training. So it's 3 years for nutrition in IMU and 4 years for dietetics.
Yeah. And the qualifications to join our degree, definitely pre-university.
Yeah, pre-university. So if you're
Yeah.
interested, you can first come into our Foundation of Science in IMU, and then we will expose you to the whole profession, both profession, and then you join us in the undergraduate.
Yeah.
Otherwise, you come in at STPM, right, or A levels or UEC, IB. As long as you're at the pre-university level, you can join the degree.
Yeah, yeah. And make sure you do your science subjects, yeah? You need your science subjects, okay?
Yes.
Yes,
You need the biology.
Biology, yes. Chemistry, yes.
Chemistry,
Biology
mathematics.
biology because it's about the human body. We deal with human body. Chemistry because food is chemistry, yeah. Okay, then you need to know how to use a calculator lah.
Yes, mathematics because you are doing a lot of prescription. So doctors prescribe dosage of medication and treatment and all. We prescribe in terms of energy, nutrients. We need to do a lot of calculations as well. So it's important to have a good mathematics background.
Yeah, and we've got a really good question as well. The third question, thank you so much. We are registered dietitians. So if we want to practice in Malaysia, must we pass our SPM, Bahasa and Sejarah?
Oh, no, I don't think we have that. We don't impose that for allied health yet.
Yeah, which is good lah, which is, yeah. So I hope that
international school can come in at the moment using our foundation to come into our foundation. No issue. As long as you meet the minimum entry requirement, you can come in.
Then after they graduate, they can already register themselves, right? Because the final year training constitutes like a placement in your clinical hours.
Yes, it's already the placement. Yes.
Okay, so we've answered those questions. So back to dietetics. The curriculum, right? There's sometimes there'll be thoughts that studying overseas is better. It's a better quality degree than say a Malaysian university. For dietetics, what are your thoughts?
Okay, so if you look at the landscape of dietetics overseas versus in Malaysia, there's slight differences. So if you Google dietetics, you find that a lot of overseas universities have combined the two to nutrition and dietetics. Okay, so it depends on the country. So if you're looking at Australia, for example, they have either a bachelor's degree in nutrition dietetics or a master's degree in nutrition dietetics. Both are entry level, all right? And in US, you've got to be careful because sometimes, although they call it a bachelor's of nutrition dietetics, they don't have a clinical component. So make sure that the clinical component is there, okay? And now US also moving to a master's degree already, for that. So I think what's key here is that in Malaysia, you just need the 4-year degree, right? And it's already embedded with clinical, like you say. So the clinical component is already embedded in the final year. And when you come out and practice, straight away you can practice, So a lot of our graduates can go out and be the only dietitian, say, in a small hospital, right? With the support of peers and all, they can actually function. Okay, so they can function better, more independent work can be done, more autonomy. So so actually, if you ask me, is there a difference? No. Whether you're overseas or here, maybe if you want to work in Malaysia, having the Malaysian degree is good because you're familiar with the food culture, you're familiar with the environment here already. So it's much easier for you to assimilate.
That's right.
And to work. Yeah.
Plus, I think they're all regulated, isn't it? All the universities in.
Yes. In Malaysia, all registration, as long as it's an accredited program, it will be regulated. Now, for overseas degrees, like for IMU's partner schools, so some of you may want to have an overseas experience. So we have Australia at the moment that you can credit transfer to. It's not twinning. I see there's a question about twinning. So
Yes,
there's a
yes.
difference. Twinning means that the curriculum belongs to the overseas university and we are delivering only their curriculum. Ours is not twinning, ours is credit transfer, meaning that it's our curriculum and the overseas university recognizes and gives you a credit transfer for it. So that means the quality of our first year or second year or third year is very good. Okay, so therefore they recognize it. When you go over there, you join their third year already. You don't have to repeat the first year and second year. So
Yeah.
for overseas degree that we are currently, IMU's partner school is Griffith University in Australia and also University of Newcastle. They are actually undergraduate degrees. When you come back to Malaysia, there is no issue because these are already accredited by the Australian qualification agencies and they are on the positive list of the Allied Health Council. So registration is not an issue. And
Okay.
then we have another one, which is you do a graduate study one, which is Rutgers State University in the US. So if you wish to, go to the US and work there, you can finish your 4 years with us and then take the master's degree with Rutgers.
Yeah. Okay. So we've answered the training. It's not training. We do a credit transfer.
Credit
Or
transfer.
we have the
Yes.
graduate program where you come up with the masters. Yeah.
Yeah.
Yeah. Where was I? Because the questions are coming in hard.
Yeah, I
I'm
think
trying
let's take
to
the
organize.
questions.
Just take the
Let's take the
questions.
questions.
Okay.
Yeah.
So we'll do one. We have questions coming in to both the Q&A panel and also the chat box. So maybe I'll address the Q&A panel first. Then we go back to the chat box. Yeah. But thank you. Please keep your questions coming because this session really is for you, right? So we have. Okay, this one is, I'm just going by order, so it's going to be all over the place, but it's by order. We talked about confinement center and we talked about the alumni being a dietitian, right? Why would a confinement center be better off?
Dietitians?
A dietitian, they're not a nutrition.
Because they provide meals. So they need the dietitian to do all the meal planning and the food service of food safety and so on, menu planning for confinement center. And also sometimes confinement center, you get GDM mothers.
Yeah.
So the dietitians will be able to provide that. Actually, nutritionists also can, not an issue, but because of the provision of food and menu planning, so they need dietitians.
Yeah. And I think Prof. Winnie mentioned the word GDM. So some mothers, when they get pregnant, they have something called gestational diabetes mellitus. Yeah. So diabetes when they have pregnancy, and that really needs a medical nutrition therapy. We have a lot of mothers with GDM in Malaysia, actually. That's something we need to tackle. This one is about the entrance. Do we need physics?
Yeah, I can't remember.
I can't remember. Okay, what I'll do is,
so,
as we answer the questions, I'll dig up the website to the entry requirements and I'll share that into the webinar chat so that everyone can have a quick look. But you need your science. I think you really need to, if you want to
I think physics
study,
is a compulsory thing.
but
it's not.
Focus
it's chemistry
on,
and biology.
Focus on those. Biology,
and mathematics.
It's about the human body, and chemistry because food is chemistry. So try and focus on that, right?
There's a question about community service. Yes, absolutely. You have to do about 160 hours of community. Now, community service is like this. Throughout IMU, we are very strong in community service because it's very important. We believe that all our students should actually get in, be able to provide service to community. So you do your community service right from year 1, year 2 onwards in what we call the MPU subjects, right? Mata Pelajaran Umum. But then there's lots of opportunity to do community. But in terms of dietetics, you do community dietetics in semester 3 now?
Yeah, we do. We expose them in
and you have to go out and to work with the community for educating them about nutrition, prevention, as well as maybe talk to a group of patients with diabetes. How should I, take care of your diet? All that has to be done. But the final year has to do community dietetics for sure, right? So you will be either posted to National Kidney Foundation, National Cancer Center, Stroke Center, NASAM, home for the aged, confinement centers, retail pharmacies. You are an intern there. So yes, the preparation to get used to patients starts early, but your final is fully there, from community to clinical to food service.
Okay. Then the other two questions, I think it's about the registration. So for those of you who have joined us, dietitians are registered, is a registered profession. So there's one that how long do we need to study to become a registered dietitian? And then we need to renew, isn't it, our registration? So how often do we need to renew that?
Okay. 13 years to study? No lah, it's not. Okay, that's wrong.
Isn't it?
I mean, nobody studies that long to be registered, and not even the doctor. So no, it's just after your degree, you qualified, then you can register, and you have to register before you can work as a dietitian. Don't forget. You cannot work first, then only register. No, your employer will be highly fined. Okay, so cannot. So you must be a registered dietitian before you work. How many years do you need to renew? We are doing every 2 years you renew your practicing. Your registration is only once, so you register only once. But to renew your practicing license, so some of us, some of you, some dietitians, they want to register as a dietitian, but then they might say, I take a career break, or I want to work with industry. I don't really do medical nutrition therapy. That's okay. Then you don't have to have practicing license. But if you want to work as a dietitian and you call yourself a dietitian and you do the work of a dietitian, then you have to have practicing license, and that has to be renewed every 2 years.
Okay. So I moved to a question that's in the chat box that's still related back to registration. Can I be both a registered nutritionist and a registered dietitian together?
That's a very good question. Actually, we are currently having a task force to look into it, multiple for registration of, because like nutrition and dietetics so close, right?
Yeah.
Can you be both? So we are exploring that, and then audiology and speech is also very close. Ear listening and speaking in allied health. So we have a lot of allied health professions that actually work closely together like that. There's a task force committee currently looking at dual registration. The act doesn't say you cannot, but it very much depends on each of the profession. So the answer is not to say cannot at all. The answer will be hang on. Let's see what the decision is in the future.
Yeah. So watch this space, and you'll probably hear of the latest updates from IMU itself as well, because I think we've got people in the panel and am I talking too much now, I think? Yeah, but yeah, watch this space, yeah. Then we also have, let me just screen now. I'm trying to lump the questions together. And then the questions are now about maybe back to studying as a dietitian, as a student. Let's see. Yeah. So we study dietetics, there's specialization as well. Is it harder as being a specialist or a normal doctor?
Oh, I see. Okay. So in dietetics, because we are allied health, we don't call ourselves specialists, we call ourselves experts, right? Specialist is for a doctor. Of course, being a specialist of a doctor is much harder, right? Because that it's more at stake, right? Because you are dealing with lives. Okay. So to be a doctor, you have to have the passion, and you have to really work very hard, because it's not easy. Now, if you want to be an expert in dietitian, to be honest, in comparison with a doctor, it's a little bit easier to be an expert in dietetics, right? Versus to be a specialist as a doctor. We haven't quite worked out what would be the qualifications needed to be an expert dietitian. It will again come in the next, I would say, less than in the next 5 years, because it's already given and provided in the act that you can be an expert dietitian registration. We haven't quite worked that out, but we're quite clear that you have to do beyond your basic degree.
Right.
You have to do your postgraduate to do that.
So easier than medicine, but not as easy as just eating more fruits and vegetables.
Yeah, definitely. Beyond, you have to do postgraduate studies for sure.
Yeah. So I think then that leads on to a question from the webinar chat, where what is the biggest challenge for, say, students taking this course? If you want to do, say, dietetics or a health-related course, when you want to see patients.
Okay. So if you want to work with patients, basically, I think first you must have passion. And be very clear about what the profession is about. Okay. Sometimes people think, oh, dietetics, nutrition, it's about food lah. I like food lah. So okay lah, I think this course is for me. Then they come in and they realize, it's like that lah. You mean I have to talk to people lah. I have to have critical thinking. I have to assess, I have to know how to prescribe. And then I need to be in a hospital environment as part of my training, at least for a start, right? For dietetics in clinical. Then I find I don't like it. I prefer to be like in dealing with making new foods and all that. So be very clear. This is a profession that is very front-facing. It's about service. When you come out to work, service above self, right? Because you're taking care of patients. So Saturdays, maybe you need to work, right? Because your patients need you. If someone is getting discharged and the doctor say, can you have a look and give the advice to the patient before the patient gets discharged? You can't say, oh, sorry, I'm going on a holiday, but there are always other people who can take over. But be very clear about it. So passion is very important. If you have a heart of service, you have patience, you have good listening skill, because here that's one of the key, good communication skill. You must be very patient to listen. Food is about life, right? So when you want to ask someone about why are you eating such a terrible diet, okay, you need to first understand my life. What are the challenges I'm having? I work late at night, right? By the time I come home, not that I can always cook for myself, right? I might need to eat out. So this is the skill that the dietitian has, where we tailor your personalized nutrition. And in order to do that, you got to understand the patient's perspective. So if you have that passion, right, that I really want to change lives using diet, right, and using evidence-based, not just go and buy supplements and, buy some of the, sometimes I see a lot of non-evidence things out there.
Yeah.
But you are clear about that, then yes, this is the profession for you, right? Using food as medicine in a proper medical nutrition therapy, evidence-based, science-based way, and working closely with other healthcare professionals, including the doctor.
Well, that means if you're a dietetic student, right, it's not going to be a walk in the park, all right? There will be challenges, but you just have to soldier on, right? Yeah. And have that passion to push you through, because whatever we do
Yes,
now is
but
for
nutrition is not difficult.
nutrition
Like rocket
is,
science,
yes,
okay?
okay.
It's not that.
Yeah.
Nutrition is not difficult.
Yeah.
And I think dietetics is also not difficult, right?
Yeah.
A lot of things are in the guidelines and all that already.
That's right.
You
That's
just
right.
need to be, but creativity is important because you think about solutions, okay? And you must love food lah, one thing. But you don't necessarily have to be a great chef. You don't have to be able to, I'm not that good in cooking, but I know at least the basics, and I know, and you'll be taught also.
Yeah.
So when someone tells you I'm having laksam and I'm from Kelantan, I know what that is.
Yeah.
But nowadays, with Google, with AI, it's very easy for you to find out what is this all about. So you know the ingredients. So I think you need to be passionate about it, and you need to be good in knowing what ingredients go into food, interested in recipes and all. You don't necessarily have to be a foodie, but some interest in food is needed lah.
Yeah. So cycling back to the question. So if you're not sure whether you want to nutrition or dietetics, it's a question now, when can I choose, right? So our new curriculum, you study 2 years first, right? You can study 2 years,
three
right?
semesters,
2 years
1.5 years.
1.5 years, so 3 semester. Then at the end of the third semester, you choose your track, whether you want to do dietetics or
But
nutrition.
when you come in, this is how it works. You will first identify what you really want, what you're interested in first. So you come in as I will register as in Bachelor's of Dietetics or in nutrition, or I want to do nutrition.
Right.
But you have an option because the first 3 semesters is the same curriculum. But if you change your mind and say, I think I like nutrition more than dietetics now, you can swap. Or the nutrition, initially you sign up for nutrition, then you say, I think I want to do dietetics instead. You can swap. That's
if
what
it's
it means.
after the third semester, cannot already.
It's hard already, because you start to diverge, and then it'll be hard for you to catch up.
But I think by the time you come to your third semester,
you will know.
You roughly know, because we have designed it so that you will taste a little bit of both professions. Not only the theory, but some of the authentic,
practical.
A little bit, practical. Then you see the feel, and then you decide where you want to go.
You'll be able to see the real, what does a dietitian really do? What is their work style like? What do nutritionists do? You'll have a good exposure to say whether I stick to my choice or I wish to change.
Yeah. So the next question in that is then an extension. So after the third semester, you go on to your second year, third year, and then the dietetics internship then happens, right? As part of the fourth year. So one
Yes.
whole year dedicated to what we call dietetic practicum, right? And that's your
Yes,
year.
that's
So
right.
we've answered that question there. Let's see. There's some okay, there's some questions that we'll answer towards the end because we've actually covered that a little bit, but we'll cover that. But there are questions now about the program itself. Like how different are we? Here it says, are we better than UPM in terms of dietetics program? I think maybe a broader question would be, how do we compare to, say, government universities? And also, for those who actually, yeah, so maybe that first. How do we compare to, say,
I
government
think, to be
universities?
very honest, we are at par with most of the government university or even better. We may be better than some other government. So it depends on the curriculum and depends on what each university offer. But we all follow program standards, okay? So all of us deliver the same content, but how we deliver is what makes it different.
Yeah.
So in IMU, you get a lot of authentic experiences. That's true. Early exposure to, real world. But we also have virtual learning. That's something IMU has. So you get, we have simulation learning, AI incorporated. So we've actually put in with the new curriculum, you learn how to work together with AI to make your your job as a dietitian easier. And we also have new campuses coming up. So the nutrition and dietetics degree will be moving to our new campus in Technology Park. We are building brand new labs, very nice labs, and brand new facilities for the students to work. We've got our student diet clinic. Now this is unique. So far only IMU has it lah. The other public universities or private don't have it yet. So what is this student diet clinic? Meaning you learn to run a service for dietetics as if it's your company. So the students run it. They set the appointments. They figure out how do I get more patients into the clinic. I look at quality. They monitor, how well the clinic is doing. Basically, once you go through our student diet clinic training and so on, you can actually think about having your own service when you go out lah. So we kind of prepare you to know what are the elements that should be looked into if you want to set up your own private practice in the future. So I think this is very unique that IMU does. And we actually have a brand new clinic also in the new site, a new campus in Technology Park, very nice clinics and all the latest equipment for you to do a good job in providing service to your patients. Okay. So I think so we have some advantage being in IMU. The other thing we have is internationalization, mobility.
What do you mean by that? Can you tell us more?
So student mobility means that you can actually choose to do in your final year overseas, right? So you can go over. So our students have gone overseas. They've gone to Taiwan. Some go to Thailand, right? Singapore. Depends on where you want to do your final leg of your training. That means after you've completed all the training, you can opt to do student mobility overseas, where you go and see how dietetics is practiced overseas. And that's a very popular thing that some of our students take up, and it's partially supported by the university. The other thing that we do in the final year is you go into real world, last 4 weeks. So many of our soon-to-be graduate also go to private hospitals. They can choose to say, I want to work, I want to go and see how it works, and then eventually get employed. So we have this program called Graduate Trainee GTP, where these are all companies, hospitals, clinics, retail pharmacies, digital health, companies and all. They actually will accept you to spend about a month with them because you've already done on your basic training. You basically can sort of intern, but work in real world setting. And that's something that our very unique that IMU does. And these GTP partners are all your future employers that will actually absorb you in, and if you're good, they offer you the job when you finish. So I think this is one of the unique things that IMU does.
Yeah.
So the internationalization, the student mobility, the student art clinic, the brand new campus and lab facilities that we are going to have, the use of virtual learning, digital resources, as well as our simulation center,
Yes.
where you learn in a safe environment before you see the real patient, right? So these are some of the advantages of doing your dietetics with us in IMU.
Yeah, and I think your sharing just now also answers one of the questions in the chat. How does this course develop for future and the demanding jobs? So we use a blend of both technology as well as a lot of authentic learning. So we let you experience it already from seeing patients to
Yes, that's
managing
right. In
clinics. Yeah.
fact, if you look at graduate employability for our
Yeah.
dietetics program, it's very good. It's been post-COVID, actually it's still 80-90% employed within the first 6 months to 1 year.
So talking about employability, two big questions. How
Mm.
much
The
salary?
salary.
Okay, and then also the other one, will artificial intelligence replace
Okay.
dietitian's job?
Let's
This is one
talk
big,
about
big
the
question.
salary
Yeah.
first. Yeah.
Yeah.
So first thing first is the salary.
Mm.
So we are a Bachelor of Science degree, right, in dietetics. So I've just done a quick survey amongst the working dietitians, especially in the private sector. Government salary, you can go and Google JPA website, you can see lah. I think now government salary has gone up also. They just revised the salary, right? So fresh graduate for all science degree is similar. So I think it's 3,000 already, not counting allowances and so on. For private sector now, it's also around 3,000 a month. So especially large organization, they do pay. Some hospitals actually do start with 4,000 even. Okay, so not bad. And it's the same as any science degree lah. So around 3 to 4K. From a survey that we did on career satisfaction, just to share with all of you. So we did a Malaysian Dietitians Association. So more than 85% of our members said that they are actually satisfied to highly satisfied with what they are doing. So it's not just about the salary. Okay. So when you're a dietitian, yes, salary is very important. So the salary is comparable. It's not lower than other science graduate. And then it goes back to performance. So if you perform well, then you get all your remuneration along with it as well. But the job satisfaction that comes from working dietitian, and these are early career dietitian, number one is autonomy and recognition of their role.
Right.
So they like that autonomy because the doctors in Malaysia, they're very fortunate and they don't tell you how to do your job. Trust you that you're the dietitian. So if I refer my case to you, you have full autonomy on how you think the case should be managed and what is your prescription for the diet. So that autonomy in some countries overseas is not there. So the doctor will be the one to tell you, oh, I think this should be a diabetic diet. Okay. But in Malaysia, we have that autonomy. That's why that registration is so important. Another thing that is they have job satisfaction because job security, okay, and also the opportunity to have leadership and management. Okay, and another one is more than 30 to 40% of the dietitians say that they have great opportunities to be promoted to a higher position in their organization. So promotion is another reason. An opportunity to improve their clinical skills and continuous professional development. Okay, so MDA does a lot, IMU does a lot of continuous CPDs that we do. I think in areas of dietetics, there's no room short for you to improve your skill.
Yes.
Wherever you're working, whether you're working in hospitals or healthcare centers or anywhere, there is actually room for you to improve your skill. So I think we must sometimes see beyond just the salary. The job satisfaction is very important. Okay, if you don't have job satisfaction, even with a very high salary, you won't be happy.
Yeah. Okay, time passes when you're having fun. It's
Yeah,
already
that's right. 2 minutes.
8:58.
Oh my
2 minutes
gosh.
before closing. And so what we'll do is there are questions on, how long does the course take? What's the salary? What's the cost like? What is the entry qualifications and all that? I've shared in the chat box. I hope you can see. That's a very good link you can click on. It gives you all the information you need about the program, and
The
then
AI part, maybe before we finish, are we going to
yes,
be
will
replaced
AI
by
replace
AI?
dietitians?
Okay,
Yes,
no, AI will
yes.
augment our role. It
Mm,
will not replace because you still need the wisdom and you still need the clinical judgment, right?
right.
At least in the immediate, I mean, currently looking at it, say 10 years, I doubt very much. But who
Yeah,
can predict the future? Robots might take over everything. So we don't know. But for the time being, looking at it, I think they still need us to be able to feed into the AI, to see how to tackle some of the questions. So I think at the end of the day, also a lot of patients, even though you have now ChatGPT and all, they still want to come and see the dietitian because it's not the same.
yeah,
It's not the same as talking to someone and sharing with someone your challenges and all that. So I think that human touch is still needed lah. So
yeah,
as of today, I would say that I don't think it will be fully replaced for sure.
yeah. So no place, huh? Okay, the other questions, I mean, I'm going to try because it's already 9, but I'm just going to try and quickly answer all, very quickly. How do you become a registered dietitian? In Malaysia, get your degree, correct? Get your degree from
Yeah, and then
accredited, then
register.
you
That's it.
register. So it's as simple as that. But different countries have got different
Accredited program, so don't
uh,
go to colleges that
training.
we don't have diplomas for dietetics, so
Okay.
don't go there.
So
If
it
they
must be
offer
a
you
degree, yeah?
this, no,
Um,
yes,
it
it
must
must
be
be a
the
degree.
degree, yeah. Do nutritionists need internship as well?
Nutritionists, they do internship in a much shorter period, about 6 months, so about 1,000 hours, and they do more community work.
Okay, less clinic,
Yes.
no clinical.
Yeah,
Okay.
no clinical.
Okay, the degree fee can be found in
Yeah,
the
in the
link I gave
website.
you. So you go to the website. This question, do we have online or weekend course for working adults?
No, we at the
Yeah,
moment no. We can there are CPDs and all, but you can't because to be a nutritionist or dietitian, because we're now a registered profession, you have to do a
right,
proper degree.
right,
Online
right.
courses and all will not qualify you as such.
Okay. Someone has asked about the career path for dietitian. So what we're going to do is maybe because we're recording this, we can we
Yeah,
post
we've
this
already answered, so you
on
can
YouTube, and
listen.
then do check that out. Then you can look back into, I think it was towards the early middle part of the conversation. Very interesting discussion. Do take some time to listen to that. And the last question to answer is about how do I get in after SPM results. So go to the main web page. It will tell you how you can do that. But yes, you need a foundation or pre-university. Do your science subjects, and then you can study, become a dietitian like Prof. Winnie and myself. All right. So I think we have answered all the
Almost
questions,
all, I think so.
almost all, yeah?
Yes, yes,
Yes.
fantastic. This is great. I mean, so
Yes.
much interest, and I hope it's really been nice to see. That's the purpose of us having this live
Yes.
talk lah,
Yes.
is to
Yes.
answer some of your queries about nutrition and about dietetics as a
Yes.
profession.
Right. So on behalf of the university, I would like to say a very big thank you to all the participants here for your interest, for feeling safe to just ask your questions. I think your questions made for very good discussion as well. And thank you, Prof. Winnie, for sharing your
Most
insights.
welcome.
Okay.
Thank you so
So good
much.
night,
Great
everyone.
moderation.
Yeah.
Good night, everybody. Hope to see you in
And
IMU.
yes, bye-bye.
Bye bye.